Good morning children, back to the class. So in previous class we have discussed about the how the both husband, male and female, how they have to be together and help each other to complete their works. There should not be a domination and or gender sensitivity we have seen. In that gender sensitivity we have seen different types of things that should not give the more importance for the boy. The girl and boy are both are equal. And in the family life, when they are doing the things, both are working. When both the husband and wife both are working, means they should share the work also. They should share whatever they are doing, taking care of the child or seeing the houseworks, whatever things, the both can together complete the works. In that way it should be there. So here we are seeing today the new lesson, new topic we can say, that is the lesson 16, patient's right. What is that? Patient's right. The patient also has a right, isn't it? Is it needed that the patient should have the right? When the patient is sick, then what right he will have? Yes, he has some rights there. So that one to understand means when the patient is, first of all he should understand his situation, in which condition he is there, how he is there and all. Then he has to realize that being a good patient does not, means when it is necessary he should speak out. When it is not necessary he no need to speak. So that is the way he has to take. And he has a right to protect about himself and the what medicine they are giving to me and all, everything the patient should know. So that is about the patient's rights we are going to see in this lesson. Health is a subject close to everybody's heart. So that is true. Everybody's heart, the health is a very very important. We say, well, health is wealth. If you are healthy, you can feel that you have so much wealth. Wealth means money. So that much importance, more than money, more than profit is, we give the importance to our health. Because if you are healthy only, you can enjoy, you can earn the money, you can look after your children or look after your parents, everything, when you are having a good health condition. So that's why we say health is very close to everybody's heart. The patient, means everybody, certain things, certain rights the patient has given because of this reason. Because health is very very important, that is the reason they have given. So here, different way, they can first thing, they can judge about themselves. They can judge about themselves, what is their condition. They have right to take out the things and see. Here, two types of things they have given, two types of modes are there, so that we will see model. The first one is a paternalistic moral. The second one is informative model. So informative model. So first one, it is the best thing is the patient has a judge. Means here in this the patient can judge. And cleanliness expert means where he is sleeping, where he is staying in that room, everything is clean or not, and he can give the suggestions to the there. They can clean like this and give the decision also. Decision making power of the patient. He can take his own decision. That power the patient has. The second one is informative. This is the patient has the consumer who is in the best position to judge what is in his or her own interest, and these views the doctor has chiefly provided of information. Means the patient has here right to keep one person side of him to guide him, and whatever the patient or whatever the other person is telling, the doctor has to listen, and according to that the doctor has to give the information he has to give. And the next one, this both are the models of this. And next, if you come the patient's rights, means the patient's rights. The patient has some rights of the patient. The patient has the right to go to the closest emergency room. He can, before he is going to operation, he is going to be appointed there. He can go closer to the emergency room and check once, is it okay, or if the patient is able to. So he has a right. Ensure that there is a child specialist in the school. So school, if you are having, in our school we have one formulary. And there they will be taking, if you have any fever or headache or any problem is there, immediately they take you people to that room, isn't it? So you all know. Then like that only, every school should have the one specialist in the school to take care. The patient has the right to respectively care given by the competent personal doctor. Means he has a right to call his personal doctor. Means he can ask that I want this doctor, I want to refer this doctor, I want to go to that doctor. He has a right. And here he has a right upon a request to give even the name of the attending the physician and the names of all the other physicians directly, indirectly participating in his care. So he has a right to know the physician who is going to take care of the physician name and details he has a right to know, and other physicians who all are going to be taking care of directly or indirectly. Everybody's names and details the patient has a right to know about the doctors. The patient has a right to write every consideration of his privacy, means the thing, medical care, what is going on, the things, what is happening, how his program is arranged, when the operation is there, or which medicine, what time they are giving, what kind of care they are going to take, which nurse will come in what time, which doctor will come in what time. All his, every step-by-step program he has the right to know. He has the right to know what hospital rules and regulations apply to his customer. Means what are the rules and regulations of the hospital. So that all the rules and regulations the patient has a right to know. According to that only the patient can join there. Then he has a right to accept the emergency procedure. Means immediately if any necessary is there, unnecessary things it is happening, means anything happen and any problem is there, means immediately he can call. The next one, again, if the patient physician must obtain the necessary informed consent from the patient to his relatives or means helper. The patient is unable to respond, unable to give answers properly. The patient's relatives or well-wishers, anybody can come and talk instead of the patient, and they should also know the details. He has a right to refuse drugs treatment, or means he has a right. Sometimes they give the injections on the back or to drug to make him to means he will not to feel the pain of that operation or like this. So he can then tell the doctors, I don't want this kind of medicine, I don't want this kind of drug to be given to me. So he has a right to refuse, and he has a right to tell that which type of medicine he wants. If that medicine is correct for him, the doctors can suggest him to take. The patient has the right to consult another physician at this request or expense. If the patient is not happy with the one physician, means with the one doctor is not happy, he has the right to go to the other physician and take his help. The patient has a right to medical treatment without the discrimination of sex, race, color, religion, nationality or source of the payment. So the patient has a right, means the treatment without. So some people, some doctors, means which religion, which caste, according in a old movies when we say, now also in some areas we say, means according to if they are in their caste or if they are in their religion or if the color is different, according to that the treatment, some places it is going on. So about wise. So like the treatment should not be there. In case like that the doctor is treating the patient has the right to question him. So this is the way he has a right to and other receiving the bills and medical bills, or how much it was, how much came for each thing, how much they are adding the amount, everything he has a right to see. These are the patient's rules. Now responsibilities of the patient. Till now we have seen the patient's rights. Rights of the patients we have seen. And now we are going to see responsibilities. The patient also should have some responsibilities. So what are they? Provide information about the patient and past illness, means everything. The patient has a responsibility if he is coming to the one hospital. Before which medicine he is giving, he was using, and who was giving him medicine, which doctor he referred, and what had happened to him exactly. Everything, hospitalization, so medication and other matters related to his health history. Whatever the matter is there about his health issues and all, when onwards he is sick and all, everything the patient has a right. Otherwise your family to refer your treatment, and means otherwise you can ask the patient is not giving proper information, means they have right to, their responsibility that they have to make sure that their relatives are giving information. So ask questions if you do not understand directions, or means if you are not understanding the directions of the doctor what they have given. Again we have our responsibility to ask and clear it the doubts. Avoid self-medicine. So we should not take a high note for fever, paracetamol, for headache this I have to take, for cold citrizine. Like you should not decide. According to after go to the doctor and refer, then according to your health condition they will be giving you. Take care of your health by doing regular exercise, eating balanced and healthy diet, sleeping. So you have to sleep on time and take the proper health diet you have to take, and eating the different balanced diet about the health, and regular exercises that also is needed. Remembering that your life is precious to you and your relatives, and hence take, means that is true. Our life is very very precious to us. We have to protect our life. Once we are living our life, means if we are not taking care of our life, you are not at all properly taking care of the life, means you only will lose your life. So sometimes when you are not at all bothering about the life, means sometimes the danger diseases also we will be getting. That's why we should have regular checkup, and we should take proper care, do the regular exercises, and take proper healthy diet, and you be happy always. So for everything we are keeping in the mind and becoming very upset. So that should not be there. We have to be very, everything we have to live and stay happily. So this is the lesson about the patient's rights. Dear children, please read the lesson, and if you think that anything is important, just you underline it and make sure that you are reading the lesson and preparing yourself for the exam well. I will be giving you question and answers as a PDF, but other things you do by yourself. Thank you, my dear children.